name is Itori Noyo, and together with my co-founder Jenny Nwokoye, we created Clafiya. Clafiya was founded to provide quality and affordable home-based services for women living in rural and remote parts of Nigeria. What we wanted was to create a platform that brings life-saving services to the doorsteps of people living in Nigeria, especially those in hard-to-reach communities which are far from accessible care. One of the reasons we applied for the Build Back Better challenge is the opportunity to bring this vision to life and to raise awareness and engage with a community of women leaders, bringing the intersection of technology and public health to the forefront. At Clafiya, we believe that everyone, everywhere, deserves access to quality and affordable healthcare services, no matter your race, your gender, or socioeconomic status. Health is a fundamental human right, and no one should be left out of that statement. Absolutely no one. Through Clafiya and our partnerships with Women in Global Health, Novartis Foundation, Inspire Minds, we are one step closer to making that statement a reality. Thanks to the funding and marketing package from the Build Back Better Challenge, we're able to do the following. First, to bring healthcare services to the homes of Nigerians by connecting them to the nearest community healthcare worker. To achieve this, we had to ensure that our platform was accessible and available to everyone. So a mobile app wasn't really going to work. Even though almost 90% of Nigerians have access to a mobile phone, only 20% have access to a smartphone. And in addition to that, 1 in 7 women have access to the internet. With those statistics in mind, we developed Clafiya to function with short USSD codes. What that simply means is that without any internet connection, Nigerians can dial a simple code on any mobile device to register, pay, and request for the nearest healthcare worker to attend to their primary healthcare needs. And for the healthcare workers, this creates an opportunity to directly connect to the people that need their services the most, all the while generating additional income for each patient they visit by promoting social entrepreneurship. Secondly, Clafiya leverages artificial intelligence to apply predictive analytics to our geotagged USSD messages for disease surveillance of emerging disease outbreaks in rural and remote regions. That way, we're able to predict the next COVID-19, Lassa fever, or any epidemic in our communities. This also enables government agencies and policymakers to make data-driven decisions regarding resource allocations for the regions impacted. In addition to bringing life-saving services to communities in Nigeria, we want to ensure that more opportunities are available for women in health technology and AI. According to UNESCO, women in sub-Saharan Africa make up only 30% of the tech industry. At Clafiya, we recognize this gender gap and want to do our part in building a more gender-balanced society. To achieve this, we are training women in rural communities to be data collectors, monitoring and evaluation officers, data analysts, programmers, or coders. What we want is for women not only to have a seat at the table, but to play a vital role in the data-driven decisions being made in their communities. For any progress to be made in our society, we simply need more women in leadership. Studies have shown that women have played an effective role in leadership, from families to communities to corporations and even nations. For example, when we look at the countries who have been successful in managing the spread of coronavirus, what majority of these countries have in common are women leaders, from Germany to New Zealand to Taiwan. These women have shown exceptional leadership by telling the truth about the pandemic, acting fast and deciding on the best methods to addressing the pandemic through the use of technology and COVID-19 testing, and by responding to their citizens with love and compassion. Female leadership in the health and technology sector is not only important to make a case for inclusiveness or gender equity and representation in global health leadership, but a lack of this representation can really continue to have serious implications for the lives and health outcomes of people around the world. Jenny and I have been inspired by the wave of creativity and innovation coming from the women in Africa and around the world, whose goals are to lift up their communities and improve the lives of people they see every day and those they'll never even meet. Like Zerlina Khan and her team in South Africa, who are bridging the gap in maternal care during the COVID-19 pandemic through Birthing Bridge, or Rhoda Adura, and her team in Ghana, who created a relevant community of African women who are passionate about using technology to revolutionize Africa through developers in Vogue. Surya Rout is intersecting technology with current health status of Nepali women for the betterment of health through Swasthanaari. Through Wheels of Life, Dr. Jamima Karuki is ensuring access of pregnant women, mothers, to hospitals and assistance through telehealth in Nairobi, Kenya. Varsha Venugopal is increasing uptake of immunizations to combat vaccine-preventable diseases in India through Suvita. So if you're a woman watching this, we need you. We need your voice, your passion, your creativity, your leadership. Honestly, you are the solution. So whatever ideas you're brewing, don't second guess yourself. Build it and bring it to light. And honestly, you don't even have to have all the answers to start. Just start where you are, because the world needs you and your life-changing ideas. Thank you.